Now we'll discuss tooth separation. The separation of the teeth may be necessary during some restorative procedures, which helps in preventing damage to the teeth and their supporting tissues, and also helps in achieving the functional contacts and contours during restorative procedures. Now we'll see what is proximal contact area is. The area of the proximal height of contour of mesial distal surface of the tooth that touches the adjacent tooth in the same arch. If you see what is height of contour, it is the area of the greatest circumference on the facial or lingual surface of the teeth and protects the gingival tissue by preventing the food impaction. Now we'll see what are embrasures are. These are V-shaped spaces between the teeth that originate at proximal contact area between adjacent teeth. They act like a spillway for passage for food during the mastication procedure. In the anterior region, they are triangular shaped, whereas in the posterior, they are tent shaped. Now we'll see the need for the tooth separation. The teeth need separation may be for the diagnosis of interproximal caries and also for cavity preparation as a means of the convenience form for providing adequate access to the proximal cavity preparations, and also for the matrix placement to create a space for inserting matrix bands, and also for polishing restorations for the ease in the class 3 and class 4 restorations, and for the repositioning of the drifted teeth due to caries or faulty restorations. We can see the methods of tooth separation. They are of two types, that is the rapid or the slow separation. The rapid separation can be achieved by the wedge principle. In this principle, a wedge-shaped device is inserted between the contact teeth to produce the desired amount of separation, such as the Elliott separator. This is a mechanical device which has a single bow with two jaws which can be adjusted by a knob. Now we can see the wedges. There are of two types, the plastic or the wooden. And the functions of the wedges, if you see, they can atraumatically retract the rubber dam and provide the correct contour for cervical portions of proximal restorations by adapting the matrix band accurately to the cervical aspect of the tooth, and they prevent the gingival overhangs of the restorations. They separate the teeth to compensate for the thickness of the matrix band, and also helps in stabilizing the matrix band and the retainer during condensation of the restorative material. Now we'll learn about the wooden wedges. They are made from soft wood like pine or hard wood like oak. They may be medicated. The wooden wedges are usually preferred as they are easy to trim and adapt well and also absorb the moisture and swell to provide adequate stabilization to the matrix band. There are two types, that is a triangular shaped or round shaped. If we discuss about the plastic wedges, they are commercially available for use with either transparent matrices or metal matrices. Now we'll see the light transmitting wedges. They are special plastic wedges which are transparent and have light reflecting core. They are designed for the use with transparent matrices while placing class 2 composite restorations. And now we'll see the wedging method. First and foremost, we should know the location where to place the wedges. That is, in the gingival embrasure area just beneath the contact point. That is, we have to check the contact point of the teeth and then place. And the selection of the wedges will be depending upon the clinical situation. That is, wooden wedges can be trimmed using a knife or scalpel to produce the custom fit. And also the placement from the lingual embrasure, which is normally larger in size but interfere with the tongue, it may be placed from the buccal side. And also length should include 1/2 to 1.3 centimeters so that it does not irritate the soft tissues. And after placement, you should always check it. If you see what is pre-wedging is, the pre-wedging is that the wedging more occlusal to the gingival margin will give an abnormal concavity, and if it is placed apical to the gingival margin, it gives gingival overhangs. So the tightness should be checked with an explorer at several points along the middle two-thirds of the gingival margin. Now we'll see what a special wedging technique such as piggyback wedging. In situations where there is a gingival recession and proximal box is shallow gingivally, a single wedge may be very much apical to the gingival margin. In such cases, a second, usually a smaller wedge, is piggybacked over the first wedge. This will ensure a proper contour of the matrix band. Now we'll see the double wedging technique. This refers to the technique using two wedges, one from the buccal aspect and another from the lingual aspect to provide close adaptation to the matrix band. This is indicated when the proximal box is wide in buccolingual dimensions. Now we'll see the wedging technique. This technique is employed primarily on the mesial aspect of the maxillary first premolars, where the teeth have the fluted concave areas in the root near the gingival margins. So placing a single wedge may still leave an open marginal gingivally. So in such cases, therefore a second wedge can be inserted between the first wedge and the band. That's how it will give the close adaptation. Now we'll see the separate wedging techniques such as the Ferrier double bow separator. It works by the traction principle. In this is the mechanical device which has two bows, and the jaws of the bow engages the embrasures of the contacting teeth gingival to the contact area. And a wrench is used to turn the threaded bar slowly to create the necessary separation. Now we'll see the slow separation method. In this employs a slow movement of the teeth over a period of several days or weeks. It is indicated when the teeth have tilted, drifted, or rotated to a considerable extent and rapid separation is not useful. That can be achieved by the rubber dam sheets. It is a small piece of heavy or extra heavy rubber dam sheet which can be stretched and positioned in the contact area between the teeth, and the separation occurs due to the thickness of the sheet. Now we'll see the separating rubber band. A separating rubber band used for orthodontic purposes can be used for achieving slow separation. It can be stretched and positioned interproximally between the teeth to produce the slow separation. Now we'll see the separating ligature wires. The orthodontic brass ligature wires can be passed through the embrasure triangle beneath the contact area to form the loop around the contact area. And these two ends can be twisted together to create a separation, but not beyond 0.5 mm. We can also use oversized resin temporary crowns. The temporary crowns are made oversized in the mesodistal dimensions, and periodically resin is added to the contact area to increase the amount of separation. We can also use orthodontic appliances. The fixed orthodontic appliances are most effective and predictable means of achieving slow tooth movement. Now we'll see the recent advances which causes the tooth separation. One of it is the fender wedge. It is a combination of the steel plate and the plastic wedge. It can be inserted into the interdental spaces as it provides a separation and acts like a protector for the tissues. It is a simplified application of the matrix band also. Now we can see the plastic wave wedge. This wedge is designed with a wave curvature that allows for an optimal adaptation to the anatomy of the cervix of the tooth. Furthermore, its elasticity enables the wedge to expand after entering the critical interproximal area.